Hello, my name is Jeanette. I'm going to be the nurse helping you out today with your appointment. Can you verify your name and date of birth?
My name is Jane Doe. I was born January 1st, 1971.
Okay, let me make sure verify that with MR. Okay. So it looks like today we're going to be performing an abdominal assessment as well as a musculoskeletal assessment. I'll explain everything as we go. If you feel any discomfort, please let me know, okay?
Okay, that sounds fine.
All right, to start, I'm going to ask a few questions about your digestion and stomach. How has your appetite been lately?
It's been a little lower than usual.
Lower than usual. Okay. Any difficulty swallowing or feeling like food is getting stuck when you eat?
Sometimes I have trouble with dry foods.
Any particular foods that bother your stomach?
Spicy foods tend to upset it a bit.
Spicy. And when you eat spicy, do you have any heartburn or indigestion?
Yes, a few times this month.
Okay. Any abdominal pain like nausea or vomiting?
No vomiting, but I do get some mild stomach pain now and then.
Okay, so mild stomach pain, but you don't vomit. How are your bowel habits? Any constipation, any diarrhea, any changes you've noticed?
I get constipated pretty often.
Okay. And when you get constipated, do you notice any rectal bleeding, or in general, anytime, do you feel any rectal bleeding, anal itching, or history of pinworms?
No, none of that.
Okay. Do you use any laxatives when you get constipated, or do you have any history of ulcers or abdominal diseases?
I use a stool softener occasionally.
Occasionally. Okay, and then lastly, I wanted to ask, do you have any issues preparing meals, like when you are prepping meals, like chewing or a change in your taste and smell?
My taste isn't as strong as it used to be.
Okay, not as strong as it used to be. I'm going to be looking at your abdomen, so I'm going to be looking for your contour, your symmetry, and your abdominal area and the condition of your skin there. So I'm just going to lift the patient's gown up, and then I will see their stomach, look for any lesions, anything protruding, if their umbilicus is midline. Okay. Next, I'm going to listen to your bowel sounds. So, let me. This may feel a little cool. I would place this on their skin, the actual stethoscope on their skin, underneath. So we're just gonna listen to those bowel sounds. Let's see. Can you scoot this way? Probably have you lay down, raise the gown up, and just listen in all four quadrants. I would base it off the belly button being in the middle. Okay. Bowel sounds are present, active in all four quadrants. Now I'm going to listen to any vascular sounds. No bruise noted. I'm gonna gently tap on your abdomen now. All right, I'm gonna gently tap on your abdomen now. Okay. So now I'm gonna be assessing the tenderness of your stomach. So I'm just gonna be palpating it lightly, and then I'll go deeper, and you let me know if any pain. So let's palpate lightly. Any pain or tenderness?
No, that's okay.
Okay, so now we're gonna go deeper and feel for any enlarged organs. Any pain when I palpate deeper?
No.
Okay. So now we'll move on to the musculoskeletal assessment. Now I'm going to ask you about your muscles and your joints. Do your joints have any pain or stiffness?
Yes, mostly my knees.
In your knees, okay. Any muscle pains, cramps, or weakness?
My legs feel weak sometimes.
Your legs feel weak sometimes. Oh, you mentioned you had the unsteady gait, right? So, have you noticed changes in your balance or your gait?
Yes, I feel unsteady occasionally.
Feel unsteady occasionally? Any back or postural changes?
Some lower back pain.
Lower back. Okay. Have you noticed changes? Any history of arthritis or injury?
My doctor told me I have mild arthritis.
Mild arthritis. Okay, have you had any falls recently?
No falls, thankfully.
Okay, no falls in the past. Okay. Did it stop? Okay. Now we'll move on to inspecting your joints and for any swelling, deformities, or changes in muscle size. So I'm just going to be looking at everything. Everything appears symmetrical. Shoulders, your knees, your joints. Let's see. So now what I'm going to do is I'm going to feel your joints now, okay? For any warmth or tenderness. I'm going to feel your shoulders. I'm going to feel your elbows. And then I'm going to feel your wrists, your knees, for what I expect. Let me see. And then your ankles as well. So I do the same, compare them. Okay, and I didn't feel how did that feel? Did that hurt at all?
No, just a little stiffness.
Okay, stiffness. Okay, we'll go through some movements now. What I'm gonna have you do is open your mouth and then move side to side like this.
Like this?
Perfect. Is any pain with that?
No pain.
Okay, now I'm gonna have you touch your chin to your chest and then look up and then side to side. Any pain?
No pain.
No pain. Okay, now I'm gonna have you lift both arms overhead, rotate them inward and outward. Yes. Okay, how does that feel?
A little tight, but okay.
A little bit tight, but okay. Okay, now I'm gonna have you push against my hands and then pull back. Okay, strength and then pull back on my hands. Okay, I notice equal strength. I'm gonna have you. You can just. We'll do both. You will do both wrists. Both hands. We're gonna have you bend and straighten your elbows. Great. Now flex and extend your wrists. Spread your fingers. Awesome. Can you squeeze my fingers?
Yes.
Okay. Strength is strong with both hands equally. Let's see. So for your hips, knees, and ankles, what we're gonna do is we're gonna lift each leg, and then rotate side to side. So I'll have you just bend your knee up and then stretch it out. Point your toes, and do the same with both. Awesome. Any pain with that?
No. I can feel this.
Yeah. Okay. Hold on. Let's see. So I'm just gonna have you push down on my hands like a gas pedal, okay? And now I'm gonna have you pull up my hands, okay? Can you please? I'm gonna have you stand in front of me or in front, and then just bend over, and then now lean side to side and rotate. Okay, how does that feel?
I can feel the stretch.
It feels like you're stretching?
Mm-hmm.
Okay, you can go ahead, sit down. After you sit down, I'm actually gonna have you walk across the room at your normal speed. Just a normal walk that you do. Okay, observing your gait. A little bit unsteady, like you mentioned. Like you mentioned, you're a little bit unsteady when you walk. This completes the abdominal and the musculoskeletal assessment I have for you. Thank you for participating. If you have any questions or concerns, please let me know. I will voice any concerns to your provider.
All right, thank you.